A few years ago, a 76-year-old chef woman was rushed to the hospital because of severe pain in her abdomen and hematuria, and doctors found 2 kidney expansion nematodes, 10 and 6 centimeters long, near her kidneys and organs. This shows that parasites can directly parasitize human kidneys or cause kidney tissue damage due to parasite antigens and the body's immune response. Although human parasitic infections are one of the rare causes of kidney disorders, the complications are enough to cause fatal injuries. According to the National Center for Biotechnology Information, NCBI, 20 of the 342 known infections of human parasites are associated with kidney disease, with schistosoma, Plasmodium, filaria, and leishmania having a significant clinical or epidemiological impact. Schistosomiasis. Schistosomiasis is caused by infection with helminths of trematodes, and the kidney is an important target organ for schistosome infection and is the most common cause of severe renal failure in patients in Africa, South America, and Asia. Renal involvement in schistosomiasis can lead to lower urinary tract lesions, immune-mediated glomerulonephritis, tubulointerstitial nephritis, and oxidative stress-mediated tubular injury. The acute phase of schistosomiasis can also induce acute nephritis with clinical manifestations of fever, liver discomfort, protein, red blood cells, and leukocyte tubularity in the urine, and in some patients, marked oliguria or hematuria and edema. In addition, when ureteral obstruction is severe, it can also lead to obstructive nephropathy. Plasmodium. Plasmodium falciparum, Plasmodium intercalens, and Plasmodium trisomy 21 all cause a variety of kidney diseases. After the invasion of Plasmodium falciparum into the human body, it is easy to induce acute glomerulonephritis and then acute renal failure because of intravascular hemolysis or severe parasitemia. The clinical manifestations of Plasmodium falciparum nephropathy include typical malaria fever, recurrent fever, or persistent low fever, swelling, oliguria, and hematuria. Triple malaria nephropathy, on the other hand, is mostly seen in children and young people groups and typically presents as nephrotic syndrome. If renal failure is accompanied by nephrotic syndrome, it can lead to end-stage renal failure in as little as 3 to 5 years. Filariasis. Filariasis is an infection by nematodes that invade the lymphatic system, mostly in the lower extremities. When filarial parasites obstruct the celiac pond and thoracic duct, they cause obstruction of lymphatic flow in the renal plexus, which can easily lead to lymphatic vessel rupture. The rupture site is mostly in the renal pelvis and ureter, etc. Celiac disease occurs when lymphatic fluid enters the urine, and if accompanied by vascular rupture, celiac hematuria will be induced. Bacterial infection due to urinary tract injury can lead to renal mons nephritis or even renal abscess. And if the renal parenchyma is severely compressed or suffers damage, it can affect the kidney function. Leishmaniasis. Leishmaniasis, also known as black fever, is a zoonotic disease caused by Leishmania protozoa. Clinical symptoms include prolonged recurrent fever, splenomegaly, anemia, wasting, leukopenia, and increased serum globulin, which can also induce clinical nephropathy. Renal injury is one of the complications of visceral leishmaniasis. The main symptoms are hematuria, proteinuria, electrolyte disturbances, and decreased glomerular filtration rate, and renal pathology mostly manifests as interstitial nephritis and thylakoid proliferative glomerulonephritis. Patients who do not receive treatment will eventually die due to complications of other diseases. The most common renal complications of parasitemia are kidney involvement, acute kidney injury, glomerulonephritis, tubular dysfunction, and renal failure. The 2 major causes of kidney injury due to parasitic infection are direct parasitism in the kidney, which destroys kidney tissue and causes local tissue degeneration and necrosis, and indirect kidney tissue damage due to an immune reaction between parasitic antigens and the body. Among the kidney diseases caused by parasitic infections, the latter may cause acute macrohemolysis due to autoimmune reasons, resulting in circulatory failure, renal failure, or even death, which is gradually gaining attention from the medical community and people around the world.